Prasad, and I'm here with a new video segment entitled Articles You Will Definitely Read Later. I've got a new one out from JAMA Network Open. It's entitled U.S. Adult Preferences for Public Allocation of a Vaccine for Coronavirus Disease 2019. It's a very interesting and timely topic. The authors of this study performed a very simple survey trying to ascertain what are the preferences of U.S. adults if we had a coronavirus vaccine in the next 12 to 18 months, and if there wasn't enough of it to go around. Who do you think should get it first? The authors phoned 1,000 people, and about 14% of them responded to this survey. And they found something rather interesting. If you poll the American public and you ask them who should get the coronavirus vaccine when there's a limited supply, they will tell you what you hope they would tell you, which is we ought to distribute it to the groups that benefit from the vaccine the most. They say high priority should be given to frontline healthcare workers, those people who put themselves on the line every day. Children between the ages of 0 and 18 who are at high risk of bad outcomes for coronavirus. Thankfully, coronavirus does not have a disproportionately large impact on children, and infection fatality rates are lowest at those ages. People who are over the age of 65 who are comorbidities that put them at high risk of death from coronavirus, that's another population that the American public surveyed in this study feel should get priority for this vaccine. Finally, essential workers, those people who work at grocery stores, who work as transit drivers, who do the jobs that haven't been able to take a day off or haven't been able to move to Zoom, they also deserve priority. I think the interesting thing about this research letter is that it confirms what many of us suspect, which is, if you're honest with the American people, if you tell them we have a vaccine, but you tell them the truth, that there's not enough to go around, who should we give it to? People tell you the right answer, which is we ought to do the most good we can do with that limited supply. They're willing to make the sacrifice for the greater good, and that is reassuring, and that is a positive note in this time where I think many of us need to hear that positive note. I think the only thing I would add to this discussion is this is going to be a fraught discussion. We have a number of candidate vaccines that are moving through the pipeline. One of them, or perhaps more, may meet the primary efficacy endpoint. The safety question about the vaccines may have more uncertainty because there'll just be a very short period of follow-up for these people. And we're debuting a vaccine in an environment where people are highly critical of vaccines, and there is an irrationality surrounding vaccines. And so we have to thread the needle oh so cautiously. We have to be properly optimistic about a vaccine. We have to not embellish or hype what it's capable of doing. We have to be cognizant of harms and uncertainties around harms. And we have to navigate this in an environment where there are many factions out there who seek to mislead the public and provide inaccurate messages around vaccines to promote some sort of false narrative or false belief system. So this is not an easy task, but this research letter gives us a note of optimism. It tells us that the American people, when you randomly pick a subset and a small subset of that participates in the survey, American people are willing to allow the vaccine to be prioritized to those who stand to benefit the most. Now, the next question is the public health question. Who are the groups and who are the people that will provide the greatest benefit for the greatest number? Who should get vaccinated first? And the one thing I'll add is that the article did not specifically ask Americans if they're willing to prioritize the vaccine to be given to racial and ethnic minorities that have suffered disproportionately from the virus's impact. But that's a question that's important for future study, and it might be relevant once we have the vaccine.